So, welcome back to Nursing Made Easy. We're going to be moving on to lesson 6, thinking about fundamental things. So, today we're going to be looking deeper into critical thinking as it revolves around the clinical judgment model and the nursing process. So, make sure that you get your notepads and everything because we're going to dig right in. So, first off, clinical or critical thinking is really the backbone of nursing. It really involves making purposeful, informed decisions to provide the best care to our patients. This really aligns perfectly with the goals of the nursing process, which you're probably learning right now, is that ADPI about assessing, diagnosing, planning, implementing, and evaluating. But today, we're just going to add a little bit of an extra twist as we blend it with the 6 steps of the clinical judgment model that NCSBN is moving to, where you're recognizing those cues, analyzing those cues, prioritizing the hypotheses, generating solutions, taking actions, and then evaluating the outcome. So join me as we start talking about that assessment. We're going to jump right into that. So when we look at assessment, it starts with really recognizing those cues. Think of it as like gathering the information that you need. And there are 2 main stages: collecting the data and then analyzing it. When you're collecting data, we gather information through doing a physical examination. We observe our patient's behavior. We take a look at any diagnostic tests that come along with them in their lab data. And we take all that information, everything the patient is giving us, and that external information that comes from tests and labs, and we interpret and validate the data that we have. So one of the things you want to keep in mind to remember is that data can be subjective or objective. And that subjective data is what the patient tells us, and the objective data is what can be observed and measurable. So remember, those two go together. In order for it to be objective, it's observable and measurable. So with diagnosing, understanding that as your role, even as a nursing student, but as you go into that role as a nurse, that we don't make the diagnosis. That's the doctors. However, there are some things that we can do to hypothesize what we think might be going on, what we think might be the diagnosis based on their symptoms or the concepts that the patient is presenting through what's going on with them. So after we recognize and we analyze those cues, then we prioritize what we think might be the problem. And this is essentially by identifying the patient's health problems. A key aspect of the diagnosis is creating a problem statement. It helps us determine what needs to change, suggesting patient goals, and then crafting an appropriate intervention. Next in this step process of planning, this is where we generate solutions. This is where we establish priorities for outpatient care. We set these goals and then we select the nursing interventions that are evidence based. It's all about creating a comprehensive plan that's tailored specifically and individually for your patient. So even when you're in class or when you're in your clinical setting and you're seeing your different patients, you have to look at them individually. When we start thinking about the concepts that we're learning within the nursing program, some of the concepts and the solutions or the expected outcomes may be the same, but your plan of care for your patient is going to be different. So make sure that in that planning phase, again, generating solutions, establishing priorities for your patient care, setting those goals, and then selecting those interventions that have an evidence-based practice behind it. And now you've come up with that plan. So now how do you implement it? This is where the rubber meets the road. It's implementing is about taking that action. It's the doing process. It's where we apply everything that we've learned in these first few weeks to care for the patient to achieve the best possible outcome. And so that's what you're doing in the fundamental. As you build onto those building blocks, we start to build on your knowledge. And by building on your knowledge, you increase the different things that you're able to do. So right now, maybe in the fundamental stages, you're just learning how to take vital signs and to interpret those vital signs based on your patient diagnosis. And then we'll add on to that as you continue on throughout your nursing program. So always remember to approach the patients with confidence, because if you're not sure, then incompetent, it makes it difficult for you to answer questions of that patient. But you won't be alone. You'll have your clinical adjunct with you, your clinical instructor. Make sure that you have them with you. But the truth is, as a nursing student, I felt like if I knew what was going on with my patient, that I collected as much information about their diagnosis as I possibly can. Like, what's going on with them? What should I expect? Do they have any of these expectations? And if so, which ones am I going to focus on? And so when I did that, I had the next C that I needed, that confidence to be able to go into the room and talk about what I knew, but also had confidence in my clinical instructor that they would back me up with anything that I didn't know. And then I always made sure that I made myself a list of things that I didn't know so that when I left, I could go and get more information or expound on that when I got home. Make sure that the other C is about caring. So we talked about competence, we talked about confidence, but now I have that caring. And then fourth is that C is that creativity. This partnership with the patient is really crucial to the success that you're planning to have with them, especially with the interventions that you're going to implement. Lastly, there's evaluating. After all our efforts, we really need to see, how did we do? Did what we choose, did the plan that we chose for our patient, the things that we chose to implement, did they have the expected outcome that we wanted them to have? Evaluation means not only just looking at the things that we like, like overall the picture, but we may have to revisit some of those cues, analyze them again, and judge the outcome of our actions. And this may be a repeated process till we get to the outcome that we have. An example would be a patient who is starting to have pain, and you rate their pain on a scale of 1 to 10, and maybe the patient says their pain is 4, which is not enough really that I would want to just jump automatically to giving them a medication to assist with their pain. I may say to them, would they like their pillow propped? I could ask them like a warm compress if the doctor, if the facility requires an order. I look at those little things that I can do to change things without automatically having to go to medication. So say the patient says to me, yes, if you could just prop my pillows, I think that would work. Well, after a bit, after about 30, 45 minutes, I come back and I assess my patient. How's your pain now? How is that adjustment doing? Did just adjusting those pillows work? Rate your pain for me on a scale of from 1 to 10, 10 being the worst. If my patient says, oh, it's 6, well, your pain's not getting better. Moving them pillows didn't help. And so now I need to do a different intervention. Maybe I need to go get them pain medication. So I go get them Tylenol, maybe because that's what it's ordered for them, because they don't have an allergy to it. And so I give them 325, 350, whatever the order is. I give them Tylenol. After I give them Tylenol, I'm going to come back and I'm going to evaluate them 45 minutes later to see what the their pain level is. When an intervention works, their pain should decrease. If it doesn't and their pain increase, then I need to either give it a little bit more time, or maybe I need to make another suggestion. So you keep doing that. Just think about the nursing process. The clinical judgment model is not staying in this linear field of first I have to assess, then I have to, next step is diagnose, then I have to plan, then I have to implement, then I have to evaluate. It's a process in which you can jump from any of those. I already know what's going on. I see what's going on. I have the information. I don't need to assess because I know it already. I have everything it is I need. I know that I need to do an intervention. This is the intervention I need to do, and I'm going to evaluate the outcome. And if that doesn't work, still have assessment information because that information hasn't changed. So I'm just going to go to what's next on my implementation list that I can try for this patient. And so you're going to realize you're constantly evaluating your patient for and determining whether or not you need to analyze them to maybe make a change in your implementation. Based on your findings, that's when you decide whether or not you want to terminate, modify, or continue your plan of care. So let's wrap things up here with a quick quiz to kind of test your understanding. So you have a patient, okay, and just thinking about the process, and maybe they start to complain that they have difficulty breathing. So you assess the patient and you realize that there's another step next that you may want to take. Is it proper for you to go, you know what, let me evaluate the situation. Maybe I need to collect more data. Maybe I need to engage in identifications of the problems, or maybe I need to test a hypothesis. Well, when you think about it, you know that they might be short of breath, but you don't really know what's causing it. So maybe you need to engage in data collection. If that's what you pick, then that's the answer. When you look back at the the process that we had here when we're thinking, like, again, the question was, a patient is admitted to the hospital with shortness of breath, and you're assessing the patient, what would you do next? And that's really how the question should have gone. Are you going to evaluate them, collect data, engage in problem identification, or test a hypothesis? Well, when you think about it, you're gonna collect more data because you need to know what's causing that shortness of breath. Is there shortness of breath because they just got finished exercising or taking the steps, or what's the cause of it? Need to collect more information before we can move on. There are probably better and other questions out there. And if you want to check that podcast out, that actually goes over those questions that will be coming. But I want to thank you guys right now just for joining us today as we really look at that clinical judgment model and the nursing process. It really has been a pleasure trying to guide you guys through these fundamental concepts. And I want you to stay tuned for lesson 7, which we're going to continue in this journey. I'm helping you guys in your education. Until next time, thanks for joining me.